So triple-negative breast cancer is a difficult-to-treat subtype. Until very recently, the mainstay of treatment was chemotherapy, and there were no targeted therapies approved for triple-negative breast cancer. With the introduction of immunotherapy into the treatment of breast cancer, this is changing. The IMpassion130 trial was the first randomized trial to show a benefit for immunotherapy in breast cancer. It is a first-line trial that randomized patients to atezolizumab or placebo in combination with first-line nab-paclitaxel chemotherapy. When we first presented the data last year, we had a mature progression-free survival data demonstrating a benefit both in the ITT but predominantly in the PD-L1 positive population. And we had an interim analysis for overall survival with just about 60% of the required events being observed at that time. At that time, we had a median follow-up of 12.9 months. What we presented here at ASCO is a second interim analysis for overall survival with 18 months of follow-up. At this point in time, we have 80% of the required events and have therefore a much more mature data set. The results confirm that overall survival is improved with the introduction of atezolizumab to standard chemotherapy. The median overall survival is 25 months in patients with PD-L1 positive tumors compared to 18 months with patients in the control arm. The hazard ratio is 0.71. Formal testing was not applied as per hierarchical design. The data are important because they confirm that with more mature, with longer follow-up, the data remains stable, demonstrating a clear signal in overall survival for this difficult-to-treat patient subgroup. We also presented updated safety data as well as data on patient-reported outcomes. The safety data are consistent with what we previously demonstrated with the longer follow-up now, show no signs of late toxicity or cumulative toxicity. They're also consistent with what we've seen for each of those drugs when given as single drugs and no synergistic toxicity. In terms of patient-reported outcomes, there was no difference in both groups, confirming the excellent tolerability of atezolizumab in this context. Based on these results, atezolizumab was approved for patients with PD-L1 positive tumors and with metastatic triple-negative breast cancer and it has been introduced in many of the guidelines, including NCCN.